where in Greece, where we also said at the moment we're having also projects related to assistance to the refugees in the country. So somebody from you will ask me the question, why MSF was created? Why do we need Senator Tanimay and Dr. Lar? What is the reason behind? Always keep in mind something, that there are different situations that are making different organizations to be created. The situation why MSF, or Doctors Without Borders, were created was that in 1969 there was a civil war in Nigeria and in Biafra, where the doctors, they were seeing people dying and people suffering, but they would not speak about, they were not able to speak about the situation where they were watching in this location. So at the same time, they were seeing a lot of problems on today's Bangladesh, the time was Pakistan, with a lot of difficulties of reaction from the side of the United Nations. So they came back to Paris, and in the office of the medical journal called Tonus that time, the doctors and journalists, they decided to create an organization called Senator Tanimay and Dr. Lar, Médecins Sans Frontières, that means Doctors Without Borders, keeping in mind that patients, they don't have borders, and diseases, they don't have borders, and doctors, when they are supposed to assist people, they don't recognize borders. I mean, they go just because they want to assist people. So they created in 1971 MSF, or Doctors Without Borders, and almost now we are about 50 years old as an organization. A very important thing when we work in our daily life are the principles that we have. So it's very important that through our life we have very important principles. So the organization and the people decided to have a principle, first of all, of humanity. That means that as a people we are assisting people in need. Second principle was the principle of independence. What does it mean, independence? Independence means that I do what is needed, whenever is needed, and for how long is needed. So, and this decision, it's not depending on what Naveen wants or what Apostolos want, but this is based on the needs of people. And in order to be independent, that's something that my grandfather used to tell me, is having your own money. If you don't have your own money, you cannot be independent. I mean, as a medical students, you know very well that your parents and your family is supporting you financially. So in order for you to support your life, otherwise you cannot be independent out of that. So independence for us is not getting money from governments. So we don't get money from the government, we get only money from individuals and private donors. The second point of principle is neutrality. Where there is a conflict and there is a problem between Naveen and Zehra, we don't take side neither of Naveen, neither of Zehra. What we want to take side, we want to be close to the patients, to assist them, and not taking side of any person or individual in the conflict. The other very important principle is the principle of impartiality. What does it mean, impartiality? Imagine yourself, you are a medical doctor in your hospital. And if you are receiving a patient who has a trauma because of a car accident, and if you are receiving a patient with 38 degrees of fever, the first one that will be taking assistance will be the one with trauma, and the second one will be the one who has 38 degrees of fever. So that means that we are providing people assistance based on their needs. So there's no equal division of assistance. So that's something very important to take into consideration. Of course, I am trying to explain to you what is MSF as an organization, and I would try to avoid a general statement like, oh, MSF, it's a medical humanitarian organization, etc. MSF for me, it's an environment that you walk in and say, I'm going to do the best I can with what I got and save as many lives as I can. So I think as a medical doctors of today and medical doctors of tomorrow, you need to prepare yourself with a lot of knowledge, but at the same time, you need to adapt your services based on what reality you face in front of you. So of course, today, we don't have the capacity of a Jibadem hospital everywhere around the world, but we have the knowledge and we need to adapt this knowledge based on this reality. Just to give you an understanding of the way how we work, in less than 72 hours, we can be everywhere around the world where it is needed. Today, we are present in 72 countries with more than 400 projects around the world. Now that I'm talking to you, 45,000 people coming out of the organization are assisting around the world. And as I said, in order to do that, we have more than 6.5 donors around the world that are helping us to provide assistance to those people. Now, the question that will be from your sides, where do we go as medical doctors? We go all around the world, in different countries and in different locations. And here you can see just an idea that every year MSF staff is providing medical assistance to about 11 million people, be that hospitalizing people, be that treatment of malaria, be that severe malnutrition, be that vaccination, or being refugee crisis. So that's our different activities that MSF teams are providing around the world. Now, when the question is, where do we intervene? What's the area of our intervention? Our interventions are around the world where there is violence, and violence is war, where there are epidemics. Today we have the epidemic and the pandemic of COVID, where there are extreme health gaps, where different groups of populations or people are being excluded from healthcare, or when natural disasters, including earthquakes and flooding, are taking place around the world. So these are the kind of main areas where we are intervening, but we'll go later on to see a little bit further in certain details. Now, your question is, what does it mean, for example, working in a disaster? How it is to work as a doctor? Imagine that you are a doctor and you are being designed from the organization to work tomorrow in Afghanistan. So imagine yourself, you are in Afghanistan, you are responsible for 5 health clinics with a component of mother and child health, meaning taking care of mothers and babies. And suddenly there is an earthquake. But you see that around your facilities, there is nothing happening, so everything is fine. The question is this an emergency? And if it's an emergency, how do you know it? Which activities you are going to do and what resources you need for that? So as a medical doctor, for the first time that you are there supporting mother and child health care, you don't know. Also, when I started with MSF, I did not know. I will give you the answers later on, but just I'll give you some scenarios and then I will go one by one to follow certain answers. Imagine yourself that you are in Africa, in Mali. Mali is one of the countries in Africa. You are working responsible for the 5 health clinics, and also you are working with mothers and babies, and you received a letter from the health clinic and they're asking you to support them. These clinics are based 75 kilometers away, and they're asking you to provide them some ringer lactate for the 5 cholera cases that have been taking place in this region. And my question to you, if you are the doctor there, it is going to ask you, what do you think, Nevin? Is this an emergency? Which activities we need to do and which means we need to put in place? And of course, you don't know the answer now, but we'll give the answer together. So I think it's important that in every situation we face, we need to do an analysis of every situation before we give an answer. Yes, no, it's an emergency, not an emergency. Last but not the least, as an example, is in a case of a war situation where you have people who are fleeing a conflict area and there is an outbreak of measles, for example. So in this situation, you need to analyze if the medical structures that are in place can respond, if this is an emergency, and which means you need to put in place. So the questions that you face in different emergency situations, like even today with COVID, but I will discuss it later on, are many questions. And sometimes those answers, as medical doctors, we don't learn them at the university. So very important thing is that in our universities also we need to learn different elements, or we need to try these elements that we're learning at the school to try to adapt in reality that we are facing on a daily basis. So let me explain now a little bit to you what is an emergency. So an emergency is where there is a rupture in a given equilibrium. So now all of us that are following this presentation, we are not in an emergency. We're just enjoying the presentation. Somebody's having some ayran, somebody's having some tea, somebody's some coffee, somebody's some kebab, whatever, and we're following the presentation. But if you want to call an emergency, it's a rupture in a given equilibrium. So if something changes today or at this moment, then we can talk about an emergency. But as medical doctors, we need to look at emergency in 2 levels. How many people are dying? That's high mortality. That's the severity of the emergency. And of course, also about the magnitude. And when we talk about magnitude, it has to do about how many people are affected by this emergency. And based on the analysis, how many people are dying and how many people are affected, like the latest, for example, event that took place in Turkey and in Greece was the earthquake in Izmir. So based on the number of people that died, there were more than 100 people that died and a large number of people being exposed. We can talk about the emergency, but at the same time, we talk about the urgency. So based on the mortality and morbidity and the number of people affected, we have to talk about if it's an urgent situation or not. Now, in order to follow up emergencies around the world, how we are doing it as an organization. So how do we know what is going on? First of all, we follow the emergency calendar. What is an emergency calendar? In different periods of the year, in different countries, there are outbreaks of diseases. And this is related, first of all, because you have very small percentage of people being vaccinated. So during the time, for example, of different epidemics, you have people more exposed to that. And that's why you have outbreaks of diseases. So this is called emergency calendar. So we know that every winter you have an outbreak of influenza or grippe, or during summer you have an outbreak of diarrhea, for example. So these are emergency due to taking place. Secondly, also we do follow internet. So there are different very important sites related to scientific data where we are linking ourselves and follow the data. Not every information that we get in internet is a safe one or it is a proper one, but we take always information from international organizations like World Health Organizations or Johns Hopkins Institution that are also reliable sources on that information. Thirdly, something that you are learning already in your school, and of course maybe you are on different grades or different SNF in your university, but an important thing is about the data that we get through medical reports. What does it mean? So on a daily basis, for example, in your clinic, you are looking at the data of your patients. So based on this data, you can see, analyzing, for example, if there's an emergency or not. Something that you can see very easy nowadays is with COVID, for example. When you see that there is a data increasing with number of patients coming into the hospital or number of patients who are getting sick at home. So based on that, you can see also if there is an emergency or not. Another source of information is getting information from different sources of networking. That could be universities, that could be local authorities, or any other organization. So that will allow you to get a better understanding of an emergency taking place around the world. Now, let's look at some scenarios about what are the MSF interventions in different crises. So first, communicable diseases, imagine at the moment COVID. So COVID is a communicable disease. What does it mean having communicable diseases in front of you? That means that we have epidemics. That means that we have pandemics. So that means that we have a big number of people being affected by such situation. Secondly, many people, millions of people around the world, they face situations of nutritional crisis or drought. So that means that these people are in need of food. And when the people are in a nutritional crisis, what we see that those people are, first of all, moving. So this is population displacement. So imagine that people, they move millions of people from one place to another. And another emergency situation is armed conflict. So already Turkey's neighboring country like Syria, you have an armed conflict going on, Savaş. So when you have a Savaş going on, what happens with, first of all, with armed conflict, you have a lot of mass casualties. So a lot of people who are dying or a lot of people who are wounded. At the same time, people who are trying to flee the war, these people are displaced. So you have refugees coming from Syria to Turkey and from Turkey then to Greece and then trying to go further. Last but not the least, regarding scenarios of emergency interventions are earthquakes and floods or the so-called natural disasters. So what happened during the earthquake? So Izmir Depremin, what happened? You had, first of all, both mass casualties, people being died or people being wounded. And at the same time, you have population displacement. Of course, in the case of Izmir, they were not displaced very far. They were placed at Bornova football stadium, and now they're placed inside of their city. So you have both situation of mass casualties and population displacement. When you have population displacement, so you have mass movements, you have also epidemics and nutritional crisis because you have people on overcrowded situations. So I think it's important to keep that in mind that in different scenarios of intervention, we need to think that in addition to the earthquake or in addition to war, there are also other situations we need to take into consideration. Pictures you have been seeing different of that. That could be flooding, that could be earthquake, that could be refugee population moving around, or populations who are placed in different cities. This is in different places in around Greece, where people are crossing from Greece to from Turkey to Greece. Or you can have refugee camps that are in not organized settings. Or you may have situations during the earthquakes, for example, where you do your interventions even in the street in order to save as many lives as you can. You may have situations like today with the COVID or Ebola. So in this type of situation, imagine as a medical doctor what you need to do now. So what you need to assess. So you are a doctor, you were told that there is an earthquake here, there is a war there, so what you need to assess. So first of all, as a doctor, you need to assess the size and severity of the emergency. So how big this emergency is about, and what is affected population. During this analysis, what you need to do as a medical doctor is to see what are the population's need, what are the vulnerable groups out of this population. So normally, you as medical doctors, you know that the vulnerable groups are children, pregnant women, and elderly people. What you need to analyze also is to see what is the local response capacity. So just take an example of the last earthquake in Izmir. So when the earthquake took place in Izmir, you had the local response capacity, meaning that the Kaymakam, the Belediyesi, and all this stuff, they try to assist the population or the local actors. So in that case, you did not need to bring international agencies and organizations to assist, but you have your own capacity in the place. Also, a very important thing to consider during an emergency situation is security. So, for example, during war situations or during situations of earthquake, also you need to take into consideration the security of your own staff. Very important thing as a medical doctor that you need to analyze and keep in mind is the organization of three very important things: time, place, and person. So what is time, place, and person? So place is the geographical extension. So if we talk about an emergency or if we talk about a difficult situation, what is the coverage of this situation? So the geographical extension, how big it is a very important one. Time, always you need to put into consideration when it started and how it is evaluated. So that's why, for example, you hear on the news, Saat Yedi Deprem Oldu. So always there's a starting point, and then it's an evolution. So that's also an important thing to analyze the period of time. It's not just without having a limit on that. And when it comes to persons, it is analysis of your population effect. So tomorrow, imagine yourself, you are in a place called Madawa. Madawa, it's a place in Niger. So here you need to analyze time, place, and person regarding the emergency. So that means how many months a malaria outbreak is taking place, where is the location, and how many people are being affected. So as a medical doctor tomorrow, if you are sent from MSF to go and work in Niger, and if I'm going to ask you what is going on about the emergency, you need to tell me where you are, how many people are being affected, and for how long time. So through this graph, for example, you have been analyzing the situation of an emergency of malaria during the year in this situation. And of course, as we can see on the red peak, it is the peak of the emergency that we need to intervene. Because from January to July, you can see that there is not much cases. So the peak it is into when the red goes very high. Now, as a medical doctor, when you go there, you need to see the emergency response capacity for the location you are sent. So first of all, when an emergency takes place, the people themselves, they try to help each other. So this is called population coping mechanism. So they know what to assist each other. Secondly, in addition to the coping mechanism, you have local response capacity. So the neighbors or people coming from the other part of the city trying to assist. Then we talk about external response capacity. So for example, during the earthquake of Izmir, you have people from Istanbul, people from Ankara who came to Izmir to assist the population. So that's external response capacity. And then you need to see as a medical doctor, what are the gaps? So by doing the analysis of the situation, you need to see what are the gaps and what you need to cover in front of the situation. So during the emergency situation, what is important thing is that the needs of the people are different on the pyramid. So the pyramid is upside down. So what we need to do as a priority of action is life-saving activities, then it's curative activities, then it's preparedness in epidemic diseases, and then it's preventive. Meaning that as a doctor, first tomorrow you're going to treat the patients who are wounded during the earthquake. Then you need to treat the patient who have probably diabetes or hypertension. And then you need to do the vaccination of children as part of their routine activities. So I think there is a prioritization of the actions you need to do during an emergency. Also, I will give you 10 steps that you need to keep in mind if you are a doctor working for MSF, what you need to take as a priority. First, priority is initial assessment. Initial assessment is a very good analysis of the needs and the place you are going. Secondly, in the situation where there's an emergency, always the overcrowding brings always situation of measles outbreak. So in that case, you need to organize the measles immunization for the population. The third step, it's provision of water and sanitation for your people. So you need to analyze that water and sanitation is very important in order to do infection control and case management. The fourth priority is food and nutrition. So the population needs to have access to food and nutrition, meaning that also you have different groups of population. So that's an important thing to analyze about how many children there are or how many pregnant women. Then is the organization of shelter and planning. So you need to put in place facilities that people need to localize themselves on a shelter. The next step is emergency healthcare. That means the provision of emergency medical care for your people. Next step is the control of diseases and epidemics. So in order to avoid epidemics in an emergency situation, what you need to put in place, you need to put in place the surveillance data analysis, meaning that you need to collect the data in order to see how the outbreak of the diseases can take place in that situation. In order to do those activities, like imagine yourself today you are a medical student and tomorrow will be a doctor, it's very important the training of the human resources. So you need to have trained people, but at the same time, when you go in different locations around the world, you need also to train locally the people in order to provide those services for the population. And the very good success in different activities, the coordination. So the coordination of different actors, being local actors, international actors, and medical services, it's very important for the best outcome of your intervention. And always keep in mind that we take care of the security of our team, because I think in every situation, given leak, it is a very important thing because we need the people in order to offer our services for the population. Now, you told me, okay, as a medical doctor, I went and I all did these issues, but how can I know how is the situation is good or bad, or if I'm doing a good job or not? So in your medical school, I'm sure you learn about morbidity and mortality. So if you were face to face, I'll ask you a question, what's morbidity and what's mortality? But now I cannot ask you. And I will continue for you on doing that. So it's important to see what diseases and what also the death of people. So what is an important thing to analyze in different emergencies is what are the main killers, and also to see what is the weekly incident rate and what is the proportion between morbidity and mortality. So what is the proportion between people getting sick and die? So in many situations, main killers can be malaria, can be malnutrition, can be diarrhea, can be measles, and today we have respiratory infections like COVID. So in these situations, the main killer at the moment, what we're discussing, it is COVID. And it's important to analyze what is the weekly incident rate and what is the proportion between people getting sick, but also people dying of COVID. So that's why you see people getting sick or people dying out of that. Also, if we want to understand the epidemic of the disease, we need to analyze the attack rate and crude fatality rate. This sounds to you very Chinese, but these are part of epidemiology that you are going to study at your university, but it's important that you keep in mind also for the future, if you want to work for MSF, or if you want to be a public health doctor. Otherwise, if you want to be a Zengin doctor, you don't need this one, because you have your clinic and you are a very good gynecologist or a very good pediatrician. But if you want to be a public health doctor, you need to learn those elements. So the epidemic of the diseases, there are certain diseases like COVID or cholera or measles or meningitis who are creating epidemics because they are spread a big number of the population. For example, if I have diabetes, diabetes is not spread among the population. But if I have COVID at the moment I'm speaking to you and you don't have a mask, you may get infected from COVID. So next time wear a mask before for the presentation. At the same time, in a situation where you have malnutrition, you need to look at the prevalence of the severe acute malnutrition and also global acute malnutrition. So there are elements that probably you are going to learn them later on, but I need to attach and address to you at the moment. So imagine yourself, you are in a country that you are being sent in tomorrow, and this is, for example, Chad. So if you are being sent in Chad, what you need to be preparing yourself is, first of all, what happened during the year. So, and also, for example, let's take an example, not of Chad, let's take an example of Turkey. So we are based in Istanbul, and I'm giving you the map of Turkey, and I'm asking you the question, what are the possible emergencies that may take place in Turkey? So the first emergency that may take place in Turkey is the deprem. Is that right or not? Yes, everybody says yes now. Secondly, you may have a refugee situation because of the war zones that Turkey is nearby, be that Iraq or be that Syria. So the second situation will be movement of people. And third, of course, you may face flooding because in Turkey during the winter when there's a lot of rain, especially in Karadeniz, there's a lot of flooding. You see a lot of floodings in the areas. So these are the situations that you need to prepare yourself in addition to COVID, that's an extra. So that is an important thing as a medical doctor tomorrow that you are going to do your rural service activities, you need to do this analysis on your side. Then what is an important thing during an emergency situation is to have the so-called early warning system. So what is this Chinese word again about early warning system? Is that you need to put a collecting information in place. So as a medical doctor, you need to analyze information sources. Who's providing this information? Is the information coming from the media? Is the information coming from the government? Or information coming from your own clinic? So it's a very important thing to do this cross-checking of information to avoid fake news. And then you need to do an analysis of those information in order to tell me tomorrow, for example, I will ask Yaren Noor, who is now looking at the presentation, which information you have in front of you. Can you do an analysis of the information and tell me, is this an emergency or not? So I expect her to tell me first if it's an emergency, and then I'm going to provide her assistance to her. Because by just calling me and telling me, I have this information, I have to ask a question, can you do an analysis of those information? So in order to help you as a medical doctor, I'll give you some data that you don't need to prepare yourself, you don't need to analyze yourself, but you have this data in front of you. So for example, if you have crude mortality rate, what is crude mortality rate? Is the number of deaths per 10,000 people per day. So if you are replying as a medical doctor that we have one death in Konya, that's not a proper answer. So you need to tell me there is one death per 10,000 people per day. And based on the tablet on the table you have in front of you, if this number, for example, is more than 5 per 10,000 people a day, then it's major catastrophe. Because sometimes you read in the media and they say big catastrophe, big catastrophe, big catastrophe. How? We need also to use the language as medical doctors based on the data we share. And we have here for the normal population, but also for the under 5 mortality rate per. You understand a little bit about situation if it's an emergency or if situation is under control. At the same time, when you are going into a place as a medical doctor, you need also to analyze what is the capacity of your health structures. So, for example, during the earthquake of Izmir, because I follow it up very close, that's why, even though I love Izmir, first I love Istanbul, secondly I love Izmir, and then I love Ankara. So these are the places. So the medical facilities, they were not destroyed. So there was no problem to set up medical facilities in Izmir. So people could go very easy to the hospitals and everything was fine. Now, in order to prepare yourself for emergency, what you need to. Why, for example, let me tell you another example. If I decide today to go to Efe Sari, tonight I'm going to go as a visitor to his house. Today the restaurants are closed, the shops are closed, so he's alone at home. So this is an emergency. He did not know that I'm coming to his house. So in order for him to be ready to prepare himself for this emergency, to reduce morbidity and mortality, he needs to have in his cupboard and in his fridge some sujuk, some bulgur, and maybe some ekmek. Because if he does not have this situation prepared, then in front of emergency, he cannot respond to his guest. So Ben Musafir, but Musafir has nothing to eat. So in that case, in order to reduce our mortality and morbidity, we need to prepare ourselves for every emergency. What does it mean? We need to prepare ourselves on two levels. By making an analysis of the data, so it's a very important thing to do an analysis of the data, to make an analysis of the diseases. So in that case, we are prepared what to prepare for an emergency situation. So preparation from our side, we need to have tools in place that do data analysis. At the same time, we need to make this information available for ourselves. But even now that FA knows that I'm going to go there, he needs to have an emergency plan in place. So for example, you need to know, in case of an earthquake, which activities you need to do. You need to know at the same time what plan we need to put in place. So you need to be the so-called theoretical preparation plan. I'm sure that at your university, you are preparing yourself that in case of an earthquake, you have an emergency plan to move out of the building. Do you? Somebody can say like this with his head. Do you have an emergency plan at the university that in case of an earthquake, what to do or where to collect yourself?
Probably we have, but I mean, as stating personally, I don't know what.
That's a bad
is the
point. So tomorrow you need to ask your professor.
do.
That's a bad point. So tomorrow you need to ask your professor, what is our plan in case of an emergency? If a fire takes place, if an earthquake takes place, what we do? What is our meeting point? Because if everybody runs, the prem, oh, chuck you too, that doesn't help. Not panic. We need to have a plan in place. So that's why you need to have a draft, a firm plan in place. In order to prepare yourself and to have less people dying, and what does it mean? That if tomorrow an emergency takes place, as a doctor, if you look at the cupboard, if he has to look in the fridge, if he has sujuk or if he has bulgur, it's late. So he need to have in his cupboard, and from tomorrow you'll go to the supermarket to buy one package of bulgur and one sujuk to have in the fridge, because I'm going to visit him at home. So what we do in MSF, we prepare kits. So for different situations, we have kit for a malaria, we have kit for earthquake, we have kit for war zone. And these kits, for example, they are being in the warehouse. We put them in a cupboard, and these are ready to respond to different situations. So how does it look, a kit? So a metallic kit, first of all, look in that way. So for example, if I have headache at the moment, which medicine I need to take? Can somebody tell me which medicine I need to take? Not FS, somebody else. I talk it to Yaren, Idil, and FS. This is what I have in front of me. But somebody can reply to me if I have headache, which medicine I need to take. Bashagar, which medicine I need to buy in the pharmacy? Hadi. No reply? Nobody knows which medicine I need to take for my headache? Can somebody reply to it? Or somebody is writing to it? No, I need an answer. Somebody needs to open the microphone and tell me what medicine I need to take.
Paracetamol.
Paracetamol. So that's right. This person can join MSF tomorrow, because most of you would answer to me, take parol choki. Parol, it is not a name that I know. So what we do in MSF, we use all these kits. Medicines are written only with a chemical name. So as a medical doctor, you need to know very well pharmacy. So if you look at paracetamol, you will find it out. So if a doctor comes from Zimbabwe, he will find it out. So I think it's a very important thing to get a kit that is with generics, and then later on we can work with originators. So that allows you, first of all, When we use generic medicines, we use big boxes. So for example, in this brown box that you see in the middle of the kit, there are 1,000 tablets of paracetamol. Imagine, for example, the same amount of tablets if you take little blisters, it will take a big volume. So it's important also to have kits that the volume is very less, because it will allow you to transport more materials for the people that you need. So very important thing is that when you do your analysis and when you do your medical activities in emergencies, include that mental health or vaccination, etc., it's very important to do them in a concentrated way, but also in a coordinated way in order to respond to the situation. Use always the existing resources. So always we take into consideration what capacity it is in the places we go, which human resources we have there. And we need to consider different type of interventions. These are called vertical interventions in the places that we are working. From the beginning, we go to intervene in every emergency situation. We use data collection. So the first day we start our activities, we do data collection in order to ensure that we're following up epidemics. So you will ask me now how I'm going to do it. It's a very simple form. So here you have a form of you, it's ready, you print it out, and you see on your clinic, for example, just put numbers, what it is under 5, how many people you see with these conditions. So based on that, at the end of the day, it is able for you to tell me it's an emergency or it's not an emergency based on the analysis of the data. So there are always indicators for different situations. So during earthquake, there are certain indicators. I will give the presentation with you, so you don't need to look at it. So you can have it and see different indicators for earthquake. There are indicators for measles. There are indicators for diarrhea situations. So that allow you also to prepare yourself for different scenarios. And there are different situations when you have, for example, a refugee population. Like you have Syrian refugees in Turkey, there are certain indicators that help you on those thresholds. Emergency situations goes from big ones where they are working on a big number of population to situations when you need to work as an emergency on the medical room. So that goes from a big number of population to an emergency care on an emergency room. So what have been changing the last years also in environment that MSF have been working? First of all, something that has been changing is that also the traditional humanitarian settings have been changing. Before, we were thinking that, okay, we're working only in Africa, we work in Latin America, but today we're not only working in Africa and Latin America. They work also in developed countries, we work also in Europe, because the gap in coverage of emergency care activities has been changing. So we work in a very unstable setting where the sporadic violence produces mass casualties, isn't it? So we have a lot of people dying. But at the same time, we see that in middle-income countries where emergency care, it is one of the main gaps. So the emergency rooms, for example, are one of the main gaps in the middle-income countries. So what we've been doing as MSF, in addition to the emergency situations around the world where you have big earthquakes or big wars, also we've been trying to work on emergency rooms in order to save as many lives as possible on those settings. So what does an emergency room look in MSF for the one who wants to be an emergency doctor? It may look like this as a clinic, and we try also to adapt ourselves an emergency room to be like that. And this is different location, we adapt in different settings. So we've been trying to improve the settings in different locations from different countries. So meaning that also we need also to have in place guidelines and protocols to ensure that in these places we work properly, and we do also evidence data analysis. And this is helping you as a doctor to be preparing yourself better for responding to different situations. So that's an important element. Plus, we've been preparing also indicators, because when we work in different emergencies, also we need to follow up how effective we are in our work. We provide trainings to the doctors in order to be prepared for that. And also we report about this situation by producing medical data. And for example, when today you do your studies, in addition to the data you get from the normal settings like Turkey or United States, also you get data from the context like Sierra Leone or Kunduz or Afghanistan that helps you also as a doctor to understand how to respond to the situation. You gain experience, for example, working during war zones in Afghanistan or in Yemen. And you can see here, for example, that you also prepare yourself to triage. So triage is when we're looking at the green patients who do not need a very assistance, to yellow patients who need medium assistance, and to red patients who are in need of an emergency. And you can see that situations, for example, may be different. If you compare Afghanistan to Yemen, you have more people in need of emergency situation, that's in red, than in Afghanistan. And this has to do with the type of war, type of bombing and mass casualties and all this stuff. Are there challenges? There are many challenges in place that we face as MSF working in different places. So today, more and more, if you are a medical doctor working with MSF, we see more hospitals are being under bombing. In Afghanistan, Americans, in Syria, Russians, in Yemen from Saudi Arabia and coalition forces, so you see more hospitals are being bombed. We are asking the governments to stop bombing our hospitals because that's also killing patients in our hospitals. And something that I've been following up also very regular in Turkey, when you see a lot of doctors being killed by patients. Because, for example, recently in Ankara, the pediatric unit, they were closing the door for patients not to attack the doctors. And when I explained to the people saying that the doctor of your enemy is not your enemy. So as a doctor, you need to remind yourself that before being Ben Turk doctor, you are a doctor, not Turk doctor. First is, I'm a doctor. I'm Turk, but then it comes nationality. So when you are a doctor, there's no nationality. You are Turkish, Ben Turk doctor for my Turkish doctor people. When you go wherever around the world you are a doctor. For kebab, Turkey is okay, you are Turk kebab, but not for a doctor. Just keep that in mind. Because it's a very important thing that we need to differentiate as a doctor between politics and a war. It's not easy because the propaganda is very severe. Imagine finding yourself in different situations where people will tell, boo, terrorists. Terrorist, not terrorist, I'm a doctor. I need to treat him as a doctor first and then have to look at other part. So there's a judge or there's a court who have to take care of it. So you are not a lawyer. You are not a judge. You are a doctor. So first, in every situation, have to be there, have to treat. It's not an easy one because always people, they like to let people die. The issue that we face today as medical doctors as a challenge is access. Many countries, they don't allow us to go. For example, we cannot go work in the areas where the Assad is controlling in Syria. They don't allow us to go. Also, we face situations where you face a lot of asymmetries and a lot of challenges and a lot of problems that you need to address. And then also you need to adapt the model of interventions. Sometimes your patients cannot come to you on the country you are working, so sometimes we're moving patients from one country to another country in order to assist them. And the big problem that we face in our programs is the continuity of care. So sometimes you can see the patient today and maybe not see him anymore. So what you need to do as a doctor when you work with MSF, you need to do as much as possible to offer to him. For example, to give you an example, if you are yourself in a war zone and you see a patient and you don't know if you are going to be there the next day, so what you need to do is maybe to offer to the patient as much as you can in order, for example, maybe you need to offer for him the treatment for 1 month because maybe you'll not be able to see your patient the next day. This is a very nice video that probably you don't see it now because it's full Zoom, but it's a video also translated in Turkey. And the guy in the middle with a red blouse, it's a medical student. The guy in the bed is a doctor. The guy who is sitting on the chair is a patient, and the one who is assisting is the son of the guy. Why? Because today sometimes we face situations where when you are under difficult situations, you need to offer your assistance. That's why we need to be prepared for that, to be offering that type of assistance. At the same time, a big challenge that we face is the clinical part, because you'll find yourself as a doctor tomorrow with MSF in an environment of Acibadem. So you have a patient in front of you and you have to deal with it. You don't have MRI, you don't have ultrasounds, you don't have a specialized care, so you need to learn. And medicine today is your eyes, your ears, your hands, and your heart. It's not MRI. People say, hasta geldi. Okay, MRI, lütfen. No MRI. First of all, you look at the patient. Maybe the patient, for example, he has a stomach pain because he's constipated. So he needs to have a clisma, and he doesn't need to have an MRI. So I think we start wrongly thinking. We are depending on our equipment. As your colleague mentioned before, we are not face to face, but this technology helps us to be close to each other. But we don't have to be, let's say, part of technology. We need to use the technology to assist us, not to be, let's say, occupied by technology itself. So there is always possibility and needs in place, and the situation is changing. So we need to think and work in different environments from ourselves, but also we need to think on a critical mass. So we need to prepare ourselves to be ready to intervene in different situations. Let me share with you a few things about COVID-19 and how this COVID-19 find out and what happened with MSF and how this was affected for our work. First of all, we saw as MSF that as a global event around the world, we saw rich countries and their health systems collapsing because they were not prepared for such situation. We had a lot of restriction of MSF to intervene because, first of all, in developed countries like in Turkey, in Greece, or in Europe, the governments and the health system, they do not allow much of an organization or NGOs to work there. And in the countries, for example, that are poor countries like in Africa, we face difficulties because today there are no flights. Even if I want to come to Turkey, there's no flights to come to Turkey. So how I can come and assist? I can go by land, but I need also, there are other barriers. How I can go, for example, in Africa, it's very difficult. So as a disease, it's a new disease for MSF also, but the important thing is that as MSF, we have quite a big experience working with Ebola. And today, for example, we know how to work and be prepared. So the uniform you see today, the white gowns were using before the yellow ones for Ebola case management, because also Ebola before did not have vaccines, needed treatment. Now for Ebola, we have vaccine and treatment, so that help us to learn a bit better and easier on the COVID. Another issue we faced with COVID was intervention of priorities. So today, for example, most of the hospitals around the world are closed. They are working only with COVID. Today, the only news is COVID, COVID, COVID. So the rest of the diseases are not anybody dealing with that. But still people today are facing issues with diabetes, facing issues with heart problems, they need operations, women are delivering, children get sick. So I think it's a very important thing to continue and adapt operations even during COVID. You cannot stop our activities. Life is not stopping because of COVID. We need to adapt ourselves and to be prepared for that. So what we had to do as MSF during this time of COVID, we had first of all to preserve the current operations. So what we did, we continued our activities because those diseases like measles or Ebola, etc., are killing more people. At the same time, we adapted in order to ensure that in cases our patient cannot come because of the lockdown, to ensure that we could give them drugs, for example, for 3 months, or provide mental health services by phone or by Zoom for patients in order not to move out. So a very important thing is that also we deprioritize certain activities. For example, if we are planning today to vaccinate certain populations, we make an analysis if this vaccination can take place on another moment. So that allows you, for example, to prioritize your needs or surgery. For example, normal surgeries or surgeries that are not emergency can be postponed, but emergency situations cannot be postponed. So I'm giving you some examples. In North Syria, for example, the COVID-19 had a very difficulty, especially when people in refugee camps in North Syria or in the refugee camps in Greece, where populations are overcrowding and the transmission is very easy to be because of the disease themselves. So for the first time also in the history, MSF have been responding in different situations of COVID. We did activities in Spain, we did activities in Italy, in Belgium, in France, in the United States, where MSF also brought experience supporting the hospitals on the infection prevention control, or in Spain, we worked with 2 temporary health structures in Madrid in order to decongest the model of the hospitals during the COVID time. And in the United States, we worked in New York, both on infection control, but also supporting the homeless activities. So MSF provided activities for the first time working with COVID, not only in Africa, but also on the contexts of European settings. A big problem that we faced during COVID and also we face today is about the supply. Because the first moment there was no masks, there were no materials available, and many countries, they stopped allowing us to transport our means to different missions. So that also, we had to work also to ensure that supply system was in place, that PPEs, protection materials were in place. At the same time, our activities could continue normally for the rest of the supply at the same time. Also, we need to adapt ourselves, especially during the limited air travel. So we had to do medical evacuation of staff, we had to do rotation of staff, and also to increase the telemedicine. So in our project also, we are working a lot with telemedicine in order to adapt those activities. Plus, we had to scale down different projects that were on no emergency. So that was also another challenge we had to face during COVID time. COVID, of course, is giving us also a lot of opportunities. Opportunities to learn how to adapt ourselves in different new situations, because today we have COVID-19, but tomorrow we may have another disease. So at the same time, that makes also MSF to be prepared for something different. And I think if we work all together, we will be able to be prepared better for the other situation. Now, another challenge that I need to bring in front of you is the situation that we're facing today with the vaccine. So you are hearing that the Turkish people of Bioten and the Greek people from Pfizer are bringing a new vaccine, but also this vaccine is not available for everybody. Because as you may know, 90% of the doses are being sold for the people who are coming from rich countries. So how to ensure that everybody get vaccine in order to stop the pandemic? That is not a question or an answer being given by the scientific community and our government. So I think still the governments are depending on the pharmaceutical companies, and they are not able to change the situation. So let me go now to last part of my presentation. Who do we need in our projects? So Sonertanimaya, Dr. Lar ne demek? Sonertanimaya, Dr. Lar, we need people that are medicals. So we need different type of medical specialties, from general practitioners to surgeons, anesthetists, gynecologists, pediatricians, and the rest of medical people. We need a lot of paramedical people. That means we need nurses, we need psychologists, we need midwives, we need pharmacists, health promoters. And of course, what are the requirements for somebody to work for MSF? First of all, is the ability to work with limited resources in difficult conditions. So you need to prepare yourself to work with less means. Secondly, you need to work in unstable areas, meaning that today you may have no war, but tomorrow you may have war. So you need to prepare yourself working in unstable areas. Last but not least, also the flexibility and ability to manage stress. So it's a very important thing to ensure yourself that you are able to manage stress in different situations. That is related both to the places you are working, but also to the means that you have in front of you. So you are stressed from different situations. So that's why it's important to be part of that. Now, in order to do that, you need to apply to be part of MSF. But of course, what is an important thing is at the moment you are medical students. So it's too early for you to apply. So as a medical student, you can still do a lot of things by supporting MSF on different activities and campaigns. So many times we are, first of all, by inviting us again and again and talking about other issues and other topics, we'll be more than happy to be with you. So like this, you are learning at the moment about MSF work and also supporting MSF work. Secondly, we've been collaborating with both EMSA and IFMSA and Turkmensik about bringing this experience in different levels. And we've been asking you to sign different petitions and different activities or issuing a press release in order to help the work of MSF. But then when it comes to concrete examples, when you finish your medical school, it needs 2 years of professional experience. And then you need to speak a foreign language, meaning English or French. And also you need to be available for a period of 9 months to go with MSF in the field. In the places where we go, we work with intercultural mediators or translators. So also in addition, we need the foreign languages because you need to communicate first of all with the teams, because the teams are different for different countries. So you may have a Turkish doctor, a nurse from Zimbabwe, a logistician from Tantum, and another doctor from Greece. So in order to communicate, you need to find a language. So English is not my language, it's not your language, but we need to use it just to communicate with each other. And if we have another person in front of us who does not understand, probably he's going to help us on translation through as a translator. So in the project you are going tomorrow as MSF doctor, you will have also a translator in order to help you to work with your client, with your patient. So in principle, when you work with MSF, you get a contract because it is important that you get a prescription of your activities. And also you get a monthly salary, meaning that you get MASH, we call it ekmek parası. You need to get some ekmek parası because it's important for your activities. Otherwise, you cannot be a zengin. Of course, you cannot be a zengin doctor with MSF. So if you're looking to be zengin with MSF, you cannot be. But ekmek parası, you can make it. But what you get with MSF, you get a very good field experience. You get learn a lot of different environments. You learn refugees, you learn measles, you learn different diseases. And when you are in the field, you stay in the same house with the rest of the people. You have a private and medical insurance. So in case, for example, you get sick, you are also transferred from that place to another place, or in case you die, you have to come back home. It happens sometimes, not always, but it happens sometimes. So with MSF, you get a lot of professional development and international exposure. So what you learn with MSF in different projects, you don't learn them at university, or you don't learn them at Johns Hopkins University, or neither at Harvard, because that's an experience that you cannot find it in theory. When you go working with MSF, you are in the field and you are learning from different situations. But the most important thing that you learn with MSF is to contribute to saving lives. Because as a doctor, you are not just treating one patient, you treat millions of people, and with your activities, you are also bringing a lot of changes in those environments. So what I'm going to ask you is during the weekend, you go to msf.org and you get a lot of information about MSF. I'm sure you are going to do it, all of you. I'm going to check tomorrow about it. But for people who are a bit lazy, they can also visit sanırtanımayandoktorlar.org because everything is in Turkish. And of course, you can join us meanwhile as medical students by doing like in our Facebook, you can join us through Twitter, you can join us through Instagram, even though the Turkish Instagram is not working at the moment, but you can visit our website. So I'm going tonight to check you guys on the Facebook and Twitter, how many of you people have been doing like in our account, and how many requests I'm going to get tonight. So like this, I will see if you are going to follow it or not. Yes, but it's important because by joining us in these different ways, that allows, first of all, you to get your information more regularly about the work of MSF. But at the same time, with your support, we are able to get more and more people. And of course, tomorrow when you will be a real doctor, because you are already a doctor, but you will be a real doctor, you will be able to join MSF in the project. And when you will be a Zengin doctor, you'll be also giving money to MSF in order to continue the activities. That's from my side, and I'm all yours to reply to you a lot of things. I did not look at the chat before about Paro. So many people, you know, they made mistake, but I'll not mention the name who made the mistake about it. So yeah.
So thank you a lot for your speech. I think you already answered a lot of our questions and gave us clarity about your work. It was really beneficial for us, and I think we will keep this information in our mind for a long time. So now my friends are going to read out the questions we received from the Google Forms, but I guess you already answered a few of them. We will just skip them. And if other of our friends still have questions, you can write them in the chat box, or you can also write your name in the chat box, so you can ask it by opening your microphone. So Setena, you can start. Thank you.
A first question, how could you maintain and prolong your performance as a doctor?
Yeah. So when you work with MSF, you have the following opportunities. You can go for one mission, so you go for 6 months in a project, and then maybe you go home and you continue with your normal hospital life or your normal clinical life. Secondly, even for people who choose to remain and make career with MSF, there are possibilities of internal and external trainings that allows you, first of all, to develop your skills. Of course, if you work with MSF, you lose, let's say, the so-called clinical skills as a general practitioner, but you develop a lot of skills regarding public health. So you are developing another type of skill. Now, for certain specialties, like for example, surgeons, gynecologists, anesthesiologists, etc., normally they go maximum 1 month because during the difficult emergency situations, they cannot stay for long. So people, they go and come. So like this, they maintain a balance between their hospital life, clinical life, and MSF project. So training, combination between MSF projects and your clinical life allows you to maintain the medical doctor's performance as a clinician. But also do not forget something. Then when you become Usman doctor, so imagine that tomorrow you become, for example, a pediatrician. Now, all of you that I see around, when you finish your studies after 6 years, everybody will take a nice picture with the stethoscope, Ben Doctorum, like everybody's a doctor. But when we become Usman doctor, I will ask you as a pediatrician, I have my headache, and you tell me, Ben Jujuk doctor. So you have to go to the neurologist. Yeah. So I think first of all, we are doctors and then we are specialists. But what we do as medical doctors, we are becoming specialists of something and we forget about others. So of course you cannot remember all the diseases. You cannot be from pediatrician a cardiologist, but the base of cardiology, you need to be able to respond. So for example, if I have a heart attack now, you need to, even if you are a pediatric doctor, you need to tell me a little bit what is my problem, main lines, not real specific diagnose, whatever. But if you don't tell, Ben Jujuk doctor, you need to know. So I think it's important that even when we become specialists, we need to maintain certain knowledge for the rest of the community in order to assist.
Thank you. Second question, how do you approach to risks you face?
Sorry, come back again.
How do you approach to risks you face?
Anamadan.
Like, how are you approaching with the problems you're being exposed in the field?
Okay, good, excellent. So when you are for the first time, you are not alone. So normally you are always accompanied. So if tomorrow we have to go, Shetana, if we are going tomorrow to Tamtum, for example, so I have some experience, you have not much of experience. So in front of this situation, we will go together in order to be able to present ourselves. What we do, first of all, we present ourselves to the authorities or to the people there. So we go there first, we present them and tell them who we are. So together with them, then we go and follow step by step. So normally, in any country we go, we just don't go like this. We have to go to the authorities or some villages. We have to go, for example, to find, let's say, who is the oldest people in the village, or maybe who is the mullah or the teacher or the kaimakan, etc., etc. Because it's an important thing that you go in every country you go, you need to find first of all who is the owner of the place. And then with these people, you go and analyze the situation together with them. And based on the needs of those people, you are able then to come out with certain proposals. And you need to see if these proposals, for example, are accepted or not by the authorities. Because you are a doctor does not mean that they will accept your proposal. They may not accept your proposal for practical or political reasons because they don't want to expose themselves. So we may face challenges sometimes that even though there are difficult situations, we have government who says, no, problem yok. And in that case, we cannot do much on that. So we cannot impose ourselves. So these are the challenges, situations we may face time to time. But so in every situation, we have to knock the door. We need to get the acceptance of the government. But sometimes also we need to get acceptance of rebel groups. If, for example, if you are in Afghanistan, you need to get acceptance of the local government, but also of Taliban. So we go and talk to those people and explain who you are. I'm a doctor, I'm working for this organization. in order to get their acceptance, not to be killed by those people. So I think it's important to balance. But this is being done by people who have already experience, and the rest of the teams are following that.
Thank you. And third question, do you sometimes feel alone doing your job, or do you feel some sort of support from an establishment or from other people?
Yeah. In MSF, you never feel alone, because we have been setting up a team both locally but also centrally in different places, that what you need, you get it. So even you don't need to carry all the books to look about diseases and treatments. You get all the information and you have technical support. So you never feel alone in MSF. Plus also it's important thing that in the field where we are one team: doctors, nurses, logisticians, drivers, translators. So we discuss together, we live together and work together. So the results are part of the team. We do not divide ourselves and saying Ben doctor, sen hemşire, Ben pharmacist. No, we are one team. We say biz sınır tanımayan doktorlar. And I think this is something that gives you the team spirit, and I think you need to maintain the team spirit. Of course, each of us it's a separate individual. Sometimes you may feel alone, and that's something that it's important that we are taking care also of the mental health of people. So we try as a team to organize time to time some parties. We try to organize sometimes maybe a nice meal. So today, as a Greek, I'm going to do some moussaka. You're going to do some cacık, and then like this, we try to combine between the work and also the other part of life, in order to ensure that people are feeling not alone. Of course, situations have been changing, because in the past, for example, we did not have, let's say, different capacities. We did not have Zoom in the past. We did not have music in the past. Now things have been changing. But also we need to realize that also for you guys now that you are having access to many things, if tomorrow you are going to work as a doctor with MSF in a very far away in Congo, you cannot expect also having the same things in place. Also, we need to prepare ourselves about the environment that we're going to work. So let me put it differently. When I was working during the earthquake in Dusce, I had 15 days with no shower, because there was no hot water in Dusce at that time. And in the beginning, I was thinking like, what? 15 days, no douche yok? But next to my container, where I was sleeping, there were people in 10. And there were old people, and there were children, and there were more difficult conditions. And you say, I'm not alone. Those people also are facing the situation. So I think you get prepared to this type of situation, and you don't complain. So we need to complain less, because I think today we have more things than some other people. So I think it's good to have things, but not to complain, because it's günah, big günah to complain. So I think we need to balance that.
Thank you. Meryem, can you continue?
Yes, of course.
Buyurun
So the next question is, which language gives the highest advantage to be accepted in your organization?
So from the languages, you need English and French. So then the extra things, for example, if you speak Arabic, or if you speak Spanish, or you speak Russian, these are extra things. But in general, I will tell you one thing. As many things you know in life, it's always important thing. Because when you finish your university, all of you are doctors. So theoretically, if I have to choose with the criteria only being a doctor, I need to choose everybody of you. But then if I need to choose, for example, how many speak English and French, or how many speak English, maybe all speak English, okay. Then I have to choose somebody who speaks French, because I need, for the countries that they are in Africa that speak French, I need somebody who speaks French. So the one who speaks French is a bit more close to that opportunity. And if in that neighborhood, for example, there is need also of Arabic, that's something extra. So I think in general, as more tools we get, as more better also we are prepared for our life in general. So English and French are the basic languages for MSF today.
Thank you. The next question is, how can we bind with the local people, especially with those which we don't speak the mother language of? Are there any strategies to overcome the language barriers?
Yes. First of all, there are no language barriers. Why? Because people, they speak with their hearts, they speak with their eyes, and they speak with their behavior. So people, they realize and they understand that in order to communicate with each other, they always have been communicating with the body language. But what is an important thing that with the patients, of course, you cannot communicate with Tarzan language because it's not possible. We work through intercultural mediators. Even with the local community, we try to work with intercultural mediators to avoid mistakes. What we learn from our teams is that in every country, what are the things you don't do? What things you do? You can do any other things, but things that you cannot do. For example, there are body language that maybe is fine in one country, but is wrong in another country. So for example, it's okay, and this is something that's accepted around the world, but it's not accepted, for example, in Afghanistan as a body language. So these are things that you learn that when you go to another country, you avoid doing things that probably can affect others. But if you are yourself and you behave as you are without trying to mimic the next of the country, people, they accept you. For example, when I worked in Dusha and in Bolu, because I was working before in Azerbaijan, I spoke some Azeri, even though Azeri is not very close to Turkish. But it was okay for me because I had to tell them, Salam alaikum, alaikum assalam, Najasan, Nasarsan. So like these people, I say, çok iyi Türkçe konuşuyorsun. I say, well, 2-3 kelime de biliyorum. Çok iyi bilirsin. So this is something that breaks sometimes the acceptance from the community. But when the people, they feel it, that you are saying it by your heart, they feel it. If you are trying to say or to interpret differently, people, they realize it. So just be yourself. If you don't speak the language, you just speak what language you speak, and people will accept it. So you are not obliged to. For the work that you need to do with the patients, you have a translator of that. So in that case, you'll be avoiding having, let's say, mistakes that may be something that is normal in Turkey is not normal for the other country, or something that is normal in other countries is normal in Turkey. For example, when I came to Turkey, I did not know that, for example, when you want to respect an old person, you need to kiss the hand of the person, for example, and you do like this and you do like this. And in the beginning, I thought you can do it for young people also, but then, something that I tried to do it once and somebody stopped me, say this is a mistake because this is done only for the old people. So sometimes you don't have to do things that you don't understand them. You see it, but if you don't know why they're doing it, don't do it. So I think it's an important thing to be yourself and prepare yourself better. And then you can continue on the next step. At the beginning, you just became as you are.
Okay, and the last question is, what led you personally to join the MCF? What is your most unforgettable memory in this field? If you find, you can answer this question.
Listen, I think the most challenging situation that in every country I've been working are, always you have difficult moments. I mean, when you work with the MSF in different situations, sometimes you need to test yourself. I've been facing a difficult situation where I have to be in a war zone, and sometimes I was thinking why I'm here. Because, sometimes you put yourself in danger and you say, why do I need to die? I don't want to die now. But the most difficult situation, to be honest with you, have been situation with children, especially in the Greek refugee camps. And today, as you know, is the World Children's Day. When I see children, for example, that they don't have shoes, when I see children that they are having a cold, or the children that they are not going to school, this is something that I cannot accept it because I have a child. And when I see that my child, for example, is not having this problem, that is something that it makes me very sad. Because today everybody says children is our future. And when I see that children are suffering, and this is no future. So we are not treating our future. So when I hear the word children are our future, I don't believe on that anymore. So if you want children future, then you need to treat children with the proper attention. So situation where I see children suffering, it's one of the situations that have been the most painful in front of me.
Thank you for answering all our questions. Now, if the participants, if you have any other questions, you can write in the chat box, or you can just open your microphone and talk.
We don't.
So if no one's asking right now, I will use the chance and just ask something. I was wondering, does it make sense to sign up to be a doctor without border right after finishing the profession, or should we gain some experience in the clinic first?
Yeah. Let me tell you one thing. If you want to provide your assistance through MSF or other organization, always there is time in life, always. Now, there are certain minimum criteria that we have in place, and this is something that we have been not just thinking why to put this criteria. So we need people to be preparing themselves for minimum, let's say minimum knowledge, meaning that 2 years of professional experience are a basic knowledge that somebody can have going in the first mission with MSF. For example, when you finish your university, you go for 2 years working in a rural service in Konya or in Batman or in I don't know, in Zonguldak, allows you to come out with a minimum experience. And of course, based on the area that you need to work, for example, when we're asking for a surgeon, we need different experience. We're asking for an anesthesiologist, we need different experience. So it depends on which professionally, which man you need to be. So for a general practitioner or for a doctor, having 2 years of minimum experience, it's basic thing. But also you need to know what is the career path for country. Like in Turkey, you have TIP University, and then you have 2 years of experience, and then you have Uzman, you have TUS, and then you have Uzman, and then you have other 2 years. So there are different career situations that people are facing, different situations. I know many Turkish people who left Turkey and they went to Germany, for example. They don't follow TUS, they follow another career path. So based on the career path that you have per country, you may choose, for example, that after your rural service, you don't want to give TUS, you go 1 year with MSF and then you give TUS. So I think there are different areas, but I think the minimum of 2 years, it's enough for me for first mission to go with MSF, to sign up with MSF. Yeah.
Okay, does anyone else has a question?
Pascal, none.
If not, I'm going to ask a second question. I was curious, you said the missions are taking several months, and in this time, is it possible to hold contact with family and friends, or are there times you don't have contact to your home country at all?
So first of all, yes, contact with friends and contacts we are trying to have internet available in most of the places. So the people, they do Skype, they do Zoom sometimes, or they do WhatsApp or whatever. Every 3 months you can go 1 week of holidays. Of course, normally if the security allows or the situation in the country, you can do it inside of the country, or maybe you want to go home, but with your money, of course, not with MSF money. People, they cannot come and visit you. That's a bit more difficult. So for example, if you are in Tamtum, your friends cannot come and see you there. In some other places, for example, where the environment allows, like say, if you're working in countries that you take your 1 week of holidays, people, they come and visit you in the capital city, for example. So during the time of earthquake, my friends did not come to Dushe, but they come to Istanbul. So I went to meet them in Istanbul, and they could. But in reality, yes, you do maintain your contacts with the family. In some other places where it's more difficult, the communication, maybe you cannot talk every day, but you can talk every week. So we try to give all the means in place that people, they maintain their communication.
Okay, thank you for this information. It's really important to know, I think. Now I will give like 30 seconds for anyone to get a question. Maybe you will remember something in this time. And if there's no more question, we would love to take a screenshot of this photograph. So if anyone who's available could open their camera, it would be nice.